Hi everyone. So in this section today we are going to see one of the case study that is based on the diabetic drug adherence. And here is our objective to categorize the patient based on the refill of drug, means which patient is likely to refill and which patient is likely to drop off, so that we can formulate our strategy. So with this reference, we are moving to the business context. Like one of the top pharma company has launched the type 2 diabetes medication, and what they have found out that after the initial uptake, patients are not coming for the refill. So this actually poses the serious health outcomes and revenue projection as well. Like revenue going to drop as well, and patient also not getting treated as they supposed to. So this is something business context. Now coming to the problem statement or what we are going to find out here, like why patient are like not continuing the medication. Then can we predict which patient are more likely to stop the treatment early? And after finding out these patient, can we devise some mechanism so that we can improve our refill rate and adherence rate? So this is something problem statement. And now next slide, we are going to see how we formulate our solution. So first thing that the data collection. So we have collected the data like claim data, EHR data, CRM data, and patient support program data. And this data actually provided as the couple of the column like claim data provided as the fill refill rate, EHR data provided as the comorbidities and HbA1c levels, CRM data to understand the physician engagement, and the patient data to see the who is enrolled in the patient support services and which who is not. So after that, we also segment the data based on the age, gender, and then the comorbidity and the prescribing physician specialty. So prescribing physician specialty like whether the prescription is written by the any specialist or any PCP. After doing that, we going to perform the feature engineering. So feature engineering we perform based on a demographic, clinical history, prescription behavior, physician data and support program data. And after that, we build one of the predictive model SG Boost to see the score of patient likelihood on the non-adherence. So here what we do, actually we perform the model training. So we use the SG Boost classifier. Then after that we use the hyperparameter tuning and then doing the cross validation and evaluation, we come up the solution where we categorize our patient into yes or no. And yes is for the patient who is likely to refill and no who is patient who is likely to drop off. So this is something we did here, and also this actually come with some good numbers. And after that, we are going to deploy that one. And this deployment actually based on the patient specific. Now, the key insight here, like key insight that a patient with high out-of-pocket cost and no support program enrollment are more likely to drop off. And also, we find out the endocrinologist means that supposed to the um, specialty in this kind of disease have higher refill rate than the PCP. And also the third thing, we noticed that the patient whose age is less than 45 year of age or less adherence than the older one. So after identification of the patient, we divided those patients into blocks or bracket, and then the intervention has been designed. Like we start sending the patient to the high like reminders, SMS, and also pharmacy call center come into the picture for the refill reminders. And we also find out if we can provide any copay kind of support to the patient so that we can get more patient on board. Then last thing that a physician education campaign, like we find out that PCP has the higher drop off rate. So we also educated the PCPs to get the proper engagement with the patient. So with this solution, means the business impact like 50% improvement in the 6 month adherence rate means after doing these activities, significant improvement has been noticed. 8% to increase in revenue. So that is kind of correlated metrics. So if drug is selling more, the revenue is going to surge. Then the better patient outcome. So yeah, if patient are longer on the therapy, is your some H1 levels and other things also supposed to be within limit, and this is can we can say that a better patient outcome. So now last and the summary. So summary is the same thing like we just discussed in the couple of the slide before, like medication uh, based on the node adherence for new drug and the SG boost modeling that we derive here for the patient outcome and the revenue. Now the coming to the key stages and the key insights. So this is something the steps that we followed up, like prescription initiation. So patient receive initial prescription for physician, then find out the first fail, then 30-day adherence check, then 90-day drop-off rate. So then the intervention, then the improve adherence. So this is kind of steps we can say, or the insights that we follow up in the this entire process. So this is something that we followed here. And now coming to the last slide. So this is for the any query. So in case of any query, you can drop off here in the chat box. We will reach out to you for any doubt.